Hi, I'm Vanessa Lee. I'm from the Yipinguthi and Miriam people in Cape York and the Torres Strait.
So we're here at the inaugural Aboriginal and Torres Strait Islanders Suicide Prevention Conference. What brought you to the conference?
Pat and Adele and Yvonne, they sent me an email and they were saying that some of the work I've done, I've often showed a interest in the LGBTIQ mental health and suicide prevention area and domestic violence, specifically how the three interact together. And so they asked me to come and present, and if I wouldn't mind being representing the group. So here I am.
Fantastic. What did you find were the key messages that you're taking home from the conference, do you think?
I think the key messages from this conference, it was empowering. And it was really good to be in a room full of a lot of, you couldn't say everybody was like-minded, but people that came from the same historical background. You know, we have 40,000 to 60,000 years of Aboriginal and Torres Strait Islander culture, and now we have, and we're all being subjected to 220 odd years of colonisation. We would have been colonised anyway, but the reality is the way it was done, and we are still being oppressed, and our language, it's not even about languages as in the words that we speak, it's languages in how the meaning of the words in our language have taken on a new meaning, such a thing as silence. In our language, silence is reflection, and then you speak. But silence in the whole domestic violence and oppression and suicide is shh, it's a dirty little secret. It's our secret, don't share it. And so it's coming back to those sort of realities, those languages, knowing what they actually mean in our culture and how it empowers us, not disempowers us. And the other thing I'm taking away from this conference is that, you know, we came together in a workshop of people who have been through all this oppression, all this inequality and discrimination, as being gendered and sexuality diverse people, Aboriginal and Torres Strait Islander people. We have all this anecdotal records, all this anecdotal information that connects domestic violence, suicide together for sexuality and gender diverse people. What we don't have is the statistical information. We need that identification.
Yep. So if you just want to tell us a bit about what you think the policy reflections for this might be for government.
Well, I think, you know, we've got all the evidence, we've got evaluations. What we need to do is a strategy. We need a strategy. We need to bring this all together into one space, and we need to maybe look at something similar to the National Aboriginal and Torres Strait Islander Health Implementation Plan, and maybe do a suicide prevention Aboriginal and Torres Strait Islander Health Implementation Plan that is inclusive of gender and sexuality diverse people, so that we cover all angles. You know, let's get onto it. We've already got all the recommendations. Let's get onto it. Let's do it. Let's get the action done. Let's stop the suicides. Let's just stop the domestic violence. Let's stop the suicides. Let's just get it done. That's it.
Fantastic. Thank you.